Hello, my name's Claire Cameron. I'm a consultant at Health Protection at Public Health Scotland, and we work through the Scottish Vaccination and Immunisation Programme with NHS boards and Scottish Government to protect people across Scotland from vaccine preventable diseases. Today, we're here to talk about flu vaccine because if you work in the NHS in Scotland, whatever your role is, wherever you are invited for this free vaccine. So we're going to briefly describe the science behind flu vaccine. We're then going to talk about the logistics of how to book an appointment. And then we're going to showcase our campaign for this year, which highlights that for some, flu can hit harder, before closing with some key messages. So we'll start with the science behind flu vaccine. So what is flu? Well, flu is an acute viral infection of the respiratory tract. It often causes fever, headaches, aches, and a cough. So it's not just a bad cold, it will feel different. It's spread by droplets, sneezing, or hand to mouth or eye contamination from infected surfaces. There are different types of flu virus, and the viruses, they're always changing and evolving. They can be extremely serious for some people, and last winter there were more than 6,500 adults in Scotland alone who became so ill that they were admitted to hospital. So flu will be coming before Christmas. This graph shows when flu has arrived each year. Each of these different coloured lines is a different flu season, starting in 2019 to last year in red. And in 24-25 last year, infection rates in Scotland were exceptionally high. And that corresponded to an increase in hospital admissions as well, with flu circulating throughout the community. So why is an annual flu vaccine important? Well, the flu vaccine is available free of charge to all NHS workers in Scotland, regardless of where you are and what your role is. The vaccine contains specific strains of flu virus that are predicted to be circulating in the forthcoming season. So it's matched as closely as possible to what we think is going to happen. The protection from the vaccine generally lasts for one flu vaccine. So as well as the strains changing, that is why annual vaccination is important. So if you were vaccinated last year, please do get vaccinated again this year. The flu vaccine, it protects us against flu infection and particularly against severe flu disease. Not only that, it prevents us transmitting the virus to other people, so we can give wider protection to our friends, our family, and colleagues. Now, within the NHS, it's particularly important for people who have frontline contact with patients, but actually everyone can benefit, and that is why the vaccine's offered to all NHS staff. It increases our chances of staying healthy through the winter, and that's for everything in and beyond work, looking ahead as well to the holiday season. So does flu vaccine work? Yes, it definitely does work. Flu vaccine, it reduces laboratory confirmed flu among healthy adults, and it is matched to the expected strains as closely as possible. We receive it as an injection into the muscle in our upper arm. And how it works is that our body then produces antibodies via memory cells that then protect us from subsequently developing flu if our immune system encounters the flu virus for real. Now we're looking ahead to see how the vaccine can be best matched, and on average, the vaccine offers about 50% protection, but that is higher in years when the vaccine is well matched to the circulating strains. So it can be up to 70 to 80%. But regardless of the match, this is our best available protection that we have against flu. So what about side effects? Well, the flu vaccine that is given to NHS workers, it's an inactivated vaccine. So the flu viruses in the vaccine have been killed. It can't give us flu. The majority of people have no adverse effects following the vaccination. And if there are any side effects, the most common are a local reaction at the injection site. So very minor. And it's worth saying that the side effects are at quite a lower level for flu vaccine than for COVID-19 vaccines. So if you're thinking back to your COVID-19 vaccine, the level of side effects for flu are markedly lower. And almost all of us can have the vaccine. There are very few exceptions indeed. It would only be a serious anaphylactic reaction to a previous flu vaccine or a severe allergy to any of the components that would prevent us from having it. So I'm now going to hand over to my colleague Alistair Smith, who is a service manager within our vaccination and immunisation division, to be able to describe more about the logistics and how to book an appointment. Thanks, Alistair.
Thank you very much, Claire. Okay, so I'll cover the eligibility for the vaccine. Has previously been mentioned, the eligibility for the adult flu vaccination remains identical to what it was in winter 2024-25. And that does mean that all NHS staff are still eligible for the flu vaccine. If you're eligible for any other reason, including age or because you have an at-risk condition, you may have received a letter, email or text message with details of your appointment or information how to book one. So you may have already had an appointment or may already received an appointment, but what I will cover in the next couple of slides is how to book an appointment if you're not a member of those groups. So when and how can I get the vaccine? The winter flu programme has been underway from mid-September, so the short answer to the when is that you can receive your vaccine now. NHS staff can utilise drop-in clinics or they can book their vaccination using the online portal or National Vaccination Helpline. And staff can book an appointment with any board across Scotland, for example, somewhere close to where they work, live, or somewhere they visit regularly. Please check, though, the relevant health board website for any local arrangements in your area, particularly around drop-in clinics. So how to book the appointment. So there is an online booking portal available and you log into this using unique username and password. If you have lost or forgotten your username or password, you can recover it by selecting Get Your Username or the Get Your Password option. Likewise, if you have never logged in before or if you can't find your username on any appointment letter, you can get it by using the Get Your Username option, and then you can set up a password using the Select New option to register. So this is the digital method of booking an appointment, but just to highlight that there is also a national vaccination helpline where you can book an appointment through and also receive more information around the process. So there is also an online video that will describe the process in full for booking an appointment in the system. To leave us enough time for questions and answers, we will not play it in this session, but it will guide you through the full process for selection of board where you wish to receive your vaccination and also clinics within those boards. Okay, I shall now pass across to Jen.
Thank you, Alistair. So good morning, everyone. I'm Jen Renton and I'm a Communications and Marketing Manager at Public Health Scotland. Today, I'm going to showcase our new campaign, which some of you might have already seen or heard. And a bit of background, this year we have developed a brand new campaign, For any campaign, before we decide on the campaign look and feel, we test multiple options with the target audience to understand what will resonate with them, and in this case, what will encourage them to get their flu vaccine. This year's campaign is specifically targeting key audiences which we know who have had lower uptake in previous years, and this includes people with underlying health conditions, health and social care workers, and pregnant women. This year's campaign For Some Flu Hits Harder highlights that for certain people, getting flu can be really serious. The call to action for the campaign focuses on those eligible and how they can go about getting their free vaccine. I'm now sharing on screen how this creative has been brought to life. And I'll play the video for you now.
Flu hits hard, and for some it hits harder. Health and social care workers are more likely to catch and spread flu. If you're offered the flu vaccine, you've got a reason to get it. For more information, visit nhsinform.scot/flu.
We have many different videos and static images, each representing a different cohort, which are being served as paid ads on social media. We also have a radio advert, which some of you may have heard. I'll play this for you now as well if you've not.
So you've started preparing for the wonderful winter ahead, when suddenly, flu hits. The glassy throat, the barky cough, the aches, the shakes, the shivers. Now you're sweating through the sheets, struggling to breathe a bit, starting to panic a bit. Can't eat, can't think, can't move. Your room's spinning. That's new. For some, flu hits harder. So if you get an invite for the flu vaccine, you got it for a reason. To find out more, visit nhsinform.scot/flu.
The radio ad focuses on the symptoms of getting flu and reminding those eligible that getting the flu vaccine can help reduce the chances of getting ill with flu and the knock-on effect that this can have on the plans leading up to the winter period. The creative is also being shared on what we call out of home, which includes bus panels, telephone boxes and billboards. An example can be seen on screen of one of the banners on Waverley Bridge in Edinburgh city centre. You may also have seen posters that have been distributed to a wide range of locations throughout Scotland, including hospitals, pharmacies and community settings. So this is now a bit of a shout out. If you don't already, please follow Public Health Scotland and your local health boards on social media, and remember to like, comment and share content about the flu vaccine to help raise awareness. I will now pass you back to Claire.
Thank you. So this is our final slide, and this is just to highlight the key messages. So we are all, as NHS staff, eligible for the free flu vaccine. It's a simple, effective way to protect ourselves and those around us from the virus throughout the winter. It's easy to book an appointment wherever suits you. There are a couple of different methods for doing that have been highlighted, either online, phoning up, or a drop-in clinic when they become available. We would really encourage all staff to take up the offer of the vaccine, and you can find out more information at www.nhsinform.scot/flu. Thank you.